And welcome back to Smiles by Mary. I'm Pat Dewar. Dr. Mary Swift is the host of the show and the dentist we're talking to about, well, frequently asked questions, right? When we've talked about veneers, but I understand that there's a special kind of veneer, a Da Vinci veneer. What's that?
Sure. It's a veneer fabricated by a lab in California. They do all the movie stars, basically, Da Vinci labs, and they are artists. I get quality work every time. Their technicians are artists, little artists making beautiful little teeth with lots of translucency and vibrancy and lifelike features, and it's my favorite lab. Da Vinci also is unique in they offer a lifetime warranty on their work. So we touched on it earlier, but sometimes veneers require a little maintenance. You never know if you're going to, get a little blow to the mouth or, something just hit just right that porcelain needs to be repaired or replaced or attended to. And Da Vinci won't charge another fee for replacing that. So that it's a benefit to the patient, and I will definitely encourage Da Vinci if I I pretty much exclusively use them for my porcelain. The fact that they're such great artists on top of that lifetime warranty is very unique in the industry.
Just for clarification, if somebody does knock it off or have to have it replaced or whatever, Da Vinci doesn't charge for the replacement. Does the dentist?
Yeah, that's a good question. In my practice, no. If it's mine, then no. But I can't speak for all.
But that's unique. Yeah, well, that's good.
Can't speak for everybody.
What about implants? Dental implants. Who should have them and why?
Research is leading us in dentistry to believe that, and it's true based on the research, an implant is actually going to last longer in a patient's mouth than their own teeth.
Really?
I know. So if you have a patient come in, we call it cracked tooth syndrome. You're chewing your food, you get just the right texture, just the right way, on just the right tooth, and you go, ooh, what was that? And it goes away. So you don't think about it until it happens again. That's called cracked tooth syndrome. There's a crack in the tooth. That tooth traditionally would just require a crown or a cap to cover it, hold all the loose parts in tight. But over time, that tooth could eventually need a root canal, crown replaced, other procedures done, whereas an implant wouldn't. So we're just now getting to the point where that's, of the options you offer a patient in that situation, an implant is, I'm going to say, better, the best choice, only because it's the last procedure you should ever have to have done on that tooth. Not always, but more so now than it was even 10, 15 years ago. So a dental implant is a titanium post that replaces the roots of that tooth,
right,
and then a crown goes on top of that.
So it really sounds like are they going deeper into the
same level as the tooth was. You actually put the titanium post where the roots used to be, and then a crown goes on top of that. So
that's awesome. And the crowns and things of that nature, I understand that some insurance companies are actually like replacing crowns after so many years because of some things, aren't they? Or is there a need to replace crowns?
Sometimes you have to be really careful about product selection from a dentist's perspective. We have had lots of different kinds of crowns over the years. Early on, it was just a gold crown, but who wants that? So then they started putting porcelain over the metal because it looked better, but the porcelain would shear away. Now we have what we call monolithic zirconia, basically, crowns.
Really?
So it's all one piece, nothing can shear away, yet it looks beautiful, like your own tooth.
So it's monolithic to me says
one layer.
One layer.
One layer, monolithic, one layer.
I think of one like stone, but
yeah, pretty much, and indestructible. It's a great product improvement in dentistry.
I just wonder if somebody goes, I just want kind of that Jaws model of no. Any recommendation for other kinds of fillings? I mean, you talked about that. Is there any time that you would recommend any other filling?
It depends. Whether you put a filling in a tooth or a crown on a tooth depends on the amount of tooth you have.
Right.
So if your filling material exceeds the limits of, our crushing strength and all the studies of what you're supposed to be able to fill with, you want to go to a crown. It just depends. If it's a large filling, you run a risk of a tooth breaking away from the filling, put a crown on it. Filling materials in my practice, I'm all about composite resin restorations. That's the tooth-colored bonded filling material.
So you can't tell any difference from the tooth that you had, if you're good.
Exactly.
We were talking about cosmetic.
I know.
You do. If you were talking to just somebody that's wondering how to get more answers, what would you want the audience to know?
That there's a lot of good information on the internet. Invisalign for Align Technologies, Invisalign, if you're thinking about that. Yeah, the Da Vinci Lab. Get on the internet. Do some research.
You guys have a lot of stuff on your website.
And our website too.
Your website's on the screen.
Thank you. Yeah.
Go to your website. I know that these will be posted to give you good information. We're talking about, Smiles by Mary. She is the 2011, 12, and 13 Consumer Choice Award winner for cosmetic dentistry. It's a great place to start. Go to her website, get to know what they do, go in for a consultation. Spend some time with Mary. It'll make all the difference in your smile. And I have to say, having been there and done that, it made a huge difference in my smile, and it will in yours as well. Go to Dallas Cosmetic Dentist and Dallas Laser Dentistry. We'll talk to y'all next time.